rainy
Yeah.
Wednesday.
It's that kind of day, isn't it? It's a lot better than the heat we're used to.
Oh,
isn't it?
yeah. Anytime, give me this anytime, any day.
Yeah.
But when you're up the mountain, then it's difficult to wake up in the morning.
I can imagine, yeah. The visuals alone.
Oh, jeez.
Foggy and all of that.
All you want to do is stay in bed.
Oh, dear.
Then your phone starts buzzing. Hey.
Well, we are happy you didn't stay in bed today and you are here.
I'm glad to be here as well.
Today we get to start a very important conversation.
Yeah, June is a special month for us.
Tell us.
Kwame, June is Father's something. That thing, no.
That thing that they do for the fathers.
That they attempt to do for the fathers. That they do for the mothers so nicely.
But this year they are doing it nicely for the fathers now.
Sir.
Oh, yeah. This year,
okay.
people are saying their fathers are helpful, their fathers are this, that.
Yeah. I heard that earlier.
You've not heard your own, that's why.
No. So Oku school. Body house. I'm sure now. I'm not in his good books. He thinks the body house is punishment. Yes, but Kwame, June is Men's Health Month. I mean, that's what I want us to focus on, because I know that sometime in this month we're going to celebrate fathers. And so the best way is to make sure that they're in good health. Once they're in good health, I believe they're able to discharge their responsibilities. So today we're starting a 4-week series on men's health.
And we start off with a very, very familiar condition.
Right. The prostate. So, Kwame, it is prostate. All right. Not prostrate.
Right.
Yes, which is...
Prostate.
Yes. The prostate gland.
The prostate gland.
Yes.
So that's where we get the prostate cancer, the prostatitis.
Exactly. Prostatitis. Yes. And prostate enlargement, benign enlargement of the prostate. So, Kwame, you're absolutely right about that. So, good afternoon to all our listeners. And here we go. We've got a lot to discuss today. So, Kwame, as I always do, let's start with some basic biology or anatomy. First off, only males have a prostate gland.
Oh, okay.
Yep.
Some things are for men only.
Yeah, some things are for men only. So, prostate, men only. Just as if you look at it, only women have a womb, a uterus. So, men don't have a uterus. So, Kwame, all the gymnastics going about on the global stage now about this male, female, this person wants to identify as something that they are not. All those gymnastics, yes, if you have a prostate, you're a man. If you don't have a prostate, you're not a man.
So to make it simpler, if you want to be a woman, they will have to just inspect your womb.
Yes.
You say, show us.
Show us. If you can show us, okay, you if you want to be a man, show us your prostate. Although I concede it can be removed at a point. Right. So Kwame, let's do a little biology, and let's also learn a little bit about this special gland or organ that men have. So the prostate gland starts to develop in the 12th week of life. When you're in your mother's womb, 12th week, that's when it begins to develop under the influence of what we call androgens or male hormones. So most people will know the male hormone as testosterone, but there are other male hormones as well. And if you put them together collectively, we call them androgens. Right. And these androgens predominantly, or the testosterone, is coming from the testes. All right. The fetal testes. So the fetus will have nuts in the scrotum. All right. What we call the balls. And it produces testosterone or androgens. And then these androgens then influence the development of the testes from the 12th week of life. It is a solid organ which measures about 3.5 by 2.5 centimeters averagely, and it weighs between 18 to 26 grams. And just so that people can picture this, that's about like one standard size bag of crisp. Sprinkles.
What is a bag of crisps?
Oh, I mean, like if you like Sprinkles, plantain chips,
And
The
then I
one day.
can't. Then that
But say plantain chips na yeah bag no. One say
a part of scripts. What is scripts?
That would yeah face yeah.
That minima. Can't chomo. Maybe a bag of a chomo. A bag of then we can relate.
But when we don't bag those things here, you see, standards authority. We don't bagging your mouth, sad your mouth. What's it on top of it? Okay, next week, next week I'll come in. I can't measure it. The way Philip can understand. Ref is a Philip Crower. Yeah. And it is shaped like, maybe I have to skip this one too, because I'm
can
chestnut.
Wow, chestnut.
Walnut.
Where look.
And you're not ready. I can't hear burger.
Catch your burger. A browning catty. I didn't even know.
They should Google chestnut. Or okay, simply, you do a paper cone. Paper cone. I don't know the paper cone shaped. I don't know. Yeah.
We didn't do paper cones. We used
a browning catty. Okay, an inverted triangle. An inverted triangle.
Wait.
So, now I Philip can understand. Okay, so it looks like, what was a triangle? Your isosceles triangle, equilateral. Okay, all right. So, listeners, it is a small size organ. It's a small size organ and can be found just beneath the bladder. And Kwame, this location is very, very important. Or from the outside, we would say the space between the scrotum and the rectum or the anus. There's that region of the body. If you could go through that, you would hit the prostate. So its relationship with the bladder is very, very important, because if we come to talk about symptoms of prostate disease, you'd realize that we'll always be relating it to urinary symptoms.
Okay.
And this is because it is right there at the base of the bladder. Right. Now, Kwame, let's look at functions of the prostate. Why is it important? Well, to some extent, its functions are not clearly delineated, like, say, the kidney, the liver, the heart, or the pancreas. So, to a large extent, its functions are unknown. However, we know that it produces secretions or fluids, and its secretions form part of the human ejaculate. So, whenever there's a sexual intercourse or sexual activity involving a male, it will climax with an ejaculate. All right, street terms, we'll say the man will come. That fluid that comes out, all right, we call it semen. But semen is formed from different structures, or that fluid comes from different structures. The prostate gland is one of those structures that contributes the fluid to that total volume of semen that comes out. So a total volume of semen would average between 3 to 4 milliliters. Of this amount, about 1.5 milliliters of it is coming from the prostate. Within the semen, for a normal, healthy male who has reproductive capacities, within the semen, you're supposed to find sperms or spermatozoa, right? These are living cells, and they need to be nourished, all right? Because they're going to embark on a journey all the way to meet the egg in the fallopian tube. So the prostatic secretion, that fluid, about 1.5 milliliters, is rich in a lot of very important minerals, trace elements for the nourishment of the spermatozoa or for the nourishment of the sperm. So that's very, very important. So prostate secretion, in summary, helps to maintain the vitality of sperms. You find calcium in there, you find sodium in there, you find magnesium, zinc, chloride, and so many other things. But Kwame, most importantly, it contains some very, very important proteins as well. About 4 of them. But the most important one is something we call PSA, which I'm sure most people, or most men listening, would have heard of the PSA. Because most of the time when they come in for their annuals, everybody drops it now and say, oh, Dr. Ampacho, add my PSA to it. Well, PSA stands for prostatic specific antigen. Prostatic specific antigen, PSA. So it is a type of enzyme, all right? It's a catalyst and it helps to break down the clot, if you like, of the semen, the ejaculate. So you see, when semen comes out, it's thick. Then when you leave it standing for some time, it would liquefy, and most of the time, it does that because of this particular protein, which is an enzyme in there. So PSA is a very organ-specific chemical, if you like, that we find in blood. So we can use its measurement to help gain some insight into the state of health of the prostate. All right. I will not bore listeners with the other, 4 proteins, because we don't really use them in the clinic. But the PSA, I think, was very important that I mention it. So as I did mention, the prostate grows under the influence of testosterone, and which is a male hormone. And it's important to stress this particular point, because if you look at the epidemiology of prostate disease, the distribution, you'd realize that it tends to favor people of African origin compared to individuals from other races. And the reason lies in the average levels of androgens or male hormones that people of African origin have compared with, say, the average Caucasian. So we tend to have more, and it is not surprising that we tend to develop a lot more conditions from the overgrowth of the prostate. So what is prostatitis? I know it's a mouthful, prostatitis, but I'll break it down. The first part of the word comes from the word prostate, and then there's always that in medicine, when you always find that suffix itis, it stands for inflammation.
Okay.
So we can try a few things here.
Hepatitis.
Wonderful. Appendicitis. You want to go again?
Insukomatitis. It's okay.
Cholecystitis. Pancreatitis. Yeah.
Okay.
So
Inflammation.
Inflammation.
To
All
be
right.
timmy then because we take hepatitis another.
Because you are right, inflammation comes along with some cardinal signs, all right, that we look out for. One of them is swelling. It gets bigger.
Okay.
So inflammation is also the body's response to injury. An injury can come as a result of trauma, or injury can happen as a result of an infection.
Okay.
All right. So some of the cardinal features of inflammation, or one of the 4, is pain. So can you imagine you like playing tennis, so you sprain your wrist. I'm sure the first thing you would complain about to me is that, oh doc, Charlie, I go play tennis, and Charlie, my wrist they hurt.
Yeah.
So that's inflammation kicking in.
Okay.
So pain is one of the cardinal features of inflammation. So if we talk about prostatitis, we're simply referring to inflammation of the prostate, and it's typically characterized by pain. It is not possible for us to go and visualize how big it's gotten, except we do a scan to identify that. Prostatitis is a frequently painful condition, and involves inflammation of the prostate, as I mentioned, and sometimes the areas around the prostate. So the prostate is deep in your pelvis, so people sometimes come to us and say, oh doctor, if I could, but if I could stick my finger up my backside, that place, I feel some pain there. So that's how sometimes people describe what we will put down in our notes as deep pelvic pain. There are 4 main categories of prostatitis. So when we talk about prostatitis, if you like, the 4 main types. You have something we call acute bacterial prostatitis. And then we also have chronic bacterial prostatitis. All right. So Kwame, anytime we say acute, we mean sudden onset, short lasting. Okay. All right.
Yeah.
And then when we do chronic, then that's the flip side of it. All right. Gradual onset, long lasting. Okay. And bacteria means that it's caused by a germ. It's a microorganism that's gotten in there, and that is why the prostate is inflamed. Then we also have a third one, we call it chronic pelvic pain syndrome. Chronic pelvic pain syndrome. So these individuals always have pain in that deep pelvic area, and they've been investigated so many times, and we don't come up with anything in terms of an obvious cause. So we would label it, because it's going on for more than 3 months, also chronic pelvic pain syndrome. And then lastly, which is something we don't commonly see, we call it asymptomatic inflammatory prostatitis. Right. So Kwame, let's look at the first two. Those are the common ones. The bacterial prostatitis, because caused by an infection. The bacterial infection of the prostate will cause bacterial prostatitis, and the acute type happens suddenly and lasts a short time, as I mentioned. And it happens when the bacteria travel from the urethra, the tube within the penis. All right, we call that the urethra. So it's more like an ascending infection. Kwame, I think I put up a picture of the prostate, its relationship to the bladder, and you'd find that there is a tube that goes from the bladder exit through the prostate into the penis, and then it comes out. So if you have an ascending infection, meaning you're going backwards, you can pick up an infection. It enters through the tip of the penis, travels the urethra, and then gets to the prostate, which is way back.
Yeah.
So typically that's how it happens. All right.
How's that similar to the urinary tract?
Right. So it's the same thing. I mean, you are very smart. You've picked it up. So the urethra is part of the urinary tract. So when we talk about a urinary tract, we're talking about the pathway from the source of the urine, which is the kidney, through the ureters, into the bladder, through the urethra outside. All right. So that whole thing is a urinary tract. So when we talk about a urinary tract infection, then we're saying an infection anywhere in this pathway. So what I just described, you'd absolutely nailed it. A UTI can lead to, or is the reason why most people end up with a prostatitis. But if I talk about a UTI, I mean, I'm just going all the way up the track. But I'll limit myself to only that tube in the penis, and then it goes back. So we'll call that a urethritis that ends up. Kwame, I'll leave how the bacteria is picked up from the tip of the penis. I'll leave that to your imagination and to the imagination
of me, my imagination.
Or the imagination of the listeners.
I refuse to imagine it.
Okay, all right. So the end to us. So that one we can't decode it here. But anyway, now how common is this particular condition? Kwame, it is very common.
But wait, doc. It could be picked up anywhere, right?
Anywhere, say.
So you see from the tip.
Yes, that's where it enters. That's where the bacteria will enter.
Yeah.
From the tip of the man's penis.
Okay.
And then
right.
it goes.
That's fine. So it can be picked up from anywhere.
Anywhere there are germs.
So let's say you know when you sit on the W, it's okay.
That one depends on size.
Okay.
Say okay.
That one. Okay. Let's move on.
Okay. That's why I say I didn't want us to imagine things. It's still daytime reading.
I was not imagining. Some people have problems. Some people have problems. Some people,
when they sit, they should find a way of manipulating the thing, and maybe they should hold it outside.
We've been putting it on our neck.
Right, Kwame, so how would I know if I have prostatitis? How would I know? Well, there are some symptoms, and the symptoms are similar to those of other conditions. I need for us to really understand this, that it may relate to other things. You've already talked about a UTI. So let's start with chronic prostatitis or chronic pelvic pain syndrome. So Kwame, most of the time they will come complaining about pain. All right, that has lasted for more than 3 months, and the pain is in the following areas: between the scrotum and the anus. We call that area the perineum.
Okay.
The scrotum, between where the scrotum is and then the anus, that area of skin, that part of the body, we call that the perineum. And they will point to that area, showing you that's where they have the pain. They may also complain about central lower abdominal pain. So the belly button is always in the middle of the abdomen. So if you draw a line downward to where the pubic hair can be found, then we're talking about that as the lower abdomen. So central lower abdominal pain. They may actually complain about pain within the penis.
Okay.
They also complain about pain in the scrotum and then pain in the lower back. All right. So anytime anybody has any of these things, yes, your doctor will think about chronic pelvic pain syndrome or chronic prostatitis. All right. Pain during or after ejaculation, during sex and or masturbation, that you ejaculate and you have pain is also another common symptom that they may present with. The pain may come and go or appear suddenly or gradually, and this is for the chronic pelvic pain syndrome. Right. So when we talk about the acute bacterial prostatitis, where you've picked up germs and sudden onset of symptoms, these are the symptoms that usually most people will experience. Urinary frequency. When we talk about frequency, we're saying that you're urinating more frequently than you are used to.
Okay.
It's not because you've just started some water therapy or anything. Right. Then we have urinary urgency. Urgency is the urge. All right. When we get the urge, sometimes we're able to keep it. So here we are on the show right now. Quite maybe you have the edge, but you're looking at the time, you think, oh, your baby is here, and then you go and pee. You can hold it. But those with urgency, the moment they have the edge, if they don't go, disaster. Right. They may have fever, chills, a burning feeling or pain during urination, pain in the genital area, groin, lower abdomen, or the lower back. They may also experience what we call nocturia, nighttime urination. It's okay if you wake up once, twice, but if you're doing 3 times during the night, we will think that that is one too many. They may also experience nausea and vomiting. So these are the range of symptoms that people will get with the different types of prostatitis. So if you're listening and you've been experiencing any of these things, you could have a UTI, which has then progressed on to become a prostatitis, and therefore you need to visit your doctor, and the doctor will carry out a series of, or will do a thorough history taking, do a physical examination, which is very, very important. You'd probably get something we call a digital rectal examination, where we stick our gloved finger up your backside to examine the prostate. That's the only way we get access to the prostate, and then request a few investigations. All right. We'll probably do an ultrasound scan as well, and then maybe you get an appointment to see the urologist. You get a set of antibiotics and some pain relief, and then we take it from there. So usually these are the steps that we take.
Well, there's more to talk about on this particular topic, and
Absolutely.
we're going to do a part 2 of this
Next week.
I know folks have questions. A lot of people are sending me some very interesting questions that I would want to put to you.
Yeah.
But we should do that on Wednesday.
We should do that next week Wednesday, because next week Wednesday I'll tie in prostate enlargement and also prostate cancer, and then we've filled all the questions on the prostate before we move on to the other more juicy parts of men's health.
Okay. For those who want to reach out to you, what's your number, Doc?
Right, so the number is 0501-477-340. We're on WhatsApp on this, and you can come by at number 10 Kincho Street.
Thank you. Dr. Osafo, CEO of Medicas Hospital. Ken is here with the latest in news. Ken?
Indeed, it's 5 o'clock. Here are the latest news headlines from